Introduction, function, components, classification, and histology. Coming to the introduction. Bone is the living hard tissue which makes up the body of the skeleton. It is the hardest structure in the body. Coming to the functions of bone, it provides shape and support to the body. It is a site for attachment of muscles and tendons, thereby helping movement or locomotion. It protects the vital organs. It helps to storage minerals. It helps in the formation and storage of blood cells. An overview of bone. It is a vital hard tissue of mesodermal origin. The composition of bone comprises of cells and intercellular substance. As we all know, the cells of the bones are osteoblast, osteocytes, and osteoclast. Osteoblast help in bone formation. Osteocytes are entrapped osteoblast within the bone that determines the vitality of the bone, and osteoblast helps in resorption. The intercellular substance is composed of organic matrix and inorganic components. The organic matrix is called as osteoid. It's a soft tissue framework which contains collagenous and non-collagenous protein, whereas inorganic part comprises of hydroxyapatite crystals and other minerals which gives the bone strength. The formation of bone is called as osteogenesis or ossification. There are two types of bone formation. First one is intramembranous bone formation, and another one is endochondral bone formation. Bones, there are two types based on histology: immature or woven bone, and mature. And next one is mature bone. The mature bone comprises of two parts: the compact bone and spongy bone, which we will be discussing in detail in this topic. Architecture of a mature bone has two types, as I told before. It is the compact and the spongy bone. The outer hard layer of the bone is a shell-like or covering-like, is known as a compact bone. It is also known as cortical or lamellar bone. The components of the compact bone comprises of lamellae. There are different types of lamellae, mainly three types, and it comprises of circumferential, concentric, and interstitial lamellae. Within the lamellae, you can see central canals, which is known as Harvey canal, and these canals are interconnected by Walkman's canal. The cells within the bone is called as osteocytes. These are the cells which lie in a space called as lacunae. The cell body lies within the lacunae, and the cell comprises of processes which lies in a slit-like spaces which is called as canaliculae. The Harvesian canal along with the concentric lamellae together known as osteon or Harvesian system. Osteons are the basic metabolic unit of the bone. So this figure, it shows an osteon. The centrally you have the Harvesian canals, which mainly comprises of vessels and nerves, and it surrounded by concentric lamellae. Within the concentric lamellae, you can see certain cells. Outer shell or hard bone is called as cortical bone, whereas inner part of the bone, you can see trabecular type is the cancellous or spongy bone. You can see different types of lamellae here. Circumferential lamellae marked as blue, interstitial lamellae marked as red, and black as concentric lamellae. Inside concentric lamellae, you can see Harvesian canals. These topics will be taken in detail in the coming slides. You can see Harvesian canals, and they are interconnected to each other by Walkman's canal. This is the longitudinal section of the bone. An osteocyte structure. You can see the cell body which lies in the lacunae with bony slits Canaliculae. The canaliculae comprises of cell processes. The osteocyte lies in the concentric lamellae around the Haversian canal. They determine the presence of osteocyte determine the vitality of the bone. The inner part of the bone is called as spongy bone or cancellous bone. It contains a network of slender bony spicules or rolls called as trabeculae. So these are the trabeculae. Each trabeculae contains lamellae and osteocyte within, which are interconnecting canaliculae. The spongy bone lack osteon and Haversian canal. They derive their nutrition through endocytosis, through diffusion, and the sheet that covers a trabeculae is the endosteum, which is marked in red color. You can see tiny openings in case of trabeculae. These are the openings of canaliculae, and they derive nutrition from bone marrow through these openings. Within the spongy bone, you can see cavities. Between the trabeculae, smaller cavities are called as marrow spaces, and larger cavity is called as marrow cavity or medullary cavity. Medullary cavity and marrow spaces contain bone marrow. Now the fibrous lining of the bone, the outer surface of the bone, that is the outer surface of the cortical bone, lined by a fibrous sheet called as periosteum. The inner aspect of the cortical bone is lined by endosteum. Same way, the outer aspect of the spongy bone is lined by the endosteum. You can see here the green color denotes the periosteum, which is lining the outer part of the cortical bone, and inner part of the cortical bone is lined by the endosteum. These are the trabeculae, which is outlined by the endosteum. Classification of bone. Based on shape, there is long, short, flat, irregular, and sesamoid bone. Based on development, there is endochondral bones and intramembranous bone. Based on microscopic structure, there is mature bone and immature bone. Now, let's have a look at different types of bones based on the shape. We have short bones, we have long bones, we have irregular bones, and we have flat bones. The first is the long bone. For example, humerus, femur, tibia, ulna. These are the long bones. They are long and slender. They have a tubular diaphysis, which is made up of thick cortical bone, and within the central part, you have the medullary cavity. On the either side of the diaphysis, there is a broad epiphysis. The epiphyseal bone also contains spongy bone, and which is lined by the thick cortical bone. At the junction of epiphysis and diaphysis, there is epiphyseal plate. In adults, it is the epiphyseal line. Next is the short bone. Short bones are short. In the short bones, they are smaller and their length is equal to their breadth. And an example of the short bones are carpals and tarsals. They contain spongy bone with a thin layer of compact bone. The flat bones are, for example, roof of the skull, which comprises bones of the roof of the skull, which comprises of parietal, frontal, temporal, occipital bones. They contain a thin layer of spongy bone and upper and lower layer of compact bone. So this is a flat bone. Next one is an irregular bone. Irregular bones are irregular in structure. They have a complex shape. An example is maxilla and bones of the vertebral bone. It contain more spongy bone and a thin outline of compact bone. It lacks marrow cavity. Sesamoid bones, the bones develop in the tendons where there is considerable pressure or friction or tension. Example is patella. Next is the classification of bone based on formation. The bone formation is known as osteogenesis or ossification. There are two types of bones, that is endochondral bone and intramembranous bone. Endochondral bones, the mode of formation is endochondral ossification. Here the hyaline cartilage scaffold is formed initially, which will be replaced by the osseous tissue. Second one is intramembranous bone. The mode of formation is intramembranous ossification. The ossification occurs within the membranous sheet of a primitive connective tissue. As you can see here, these are the bones marked based on their formation. For example, the cranial vault, the maxilla, mandible, clavicle are formed by intramembranous ossification. The rest of the bone, like skull base, vertebrae, long bones, pelvis, etc., are formed by endochondral ossification. Based on microscopic classification, there are two types of bone. First one is the mature bone. Second one is the immature bone. The mature bone comprises of two parts, which we have already discussed: the cortical bone, the lamellar bone or compact bone, which comprises of tightly packed osteons or Harvesian systems that form solid mass. The cancellous bone is also called as spongy bone. They contain honeycomb appearance with large marrow cavity and sheets of trabeculae of bone in the form of bars and plates. Immature bone or embryonic bone or woven bone. This is a first formed bone during the embryonic period. They contain irregularly oriented collagen fibers of varying diameter. Usually they are not seen after birth because they got replaced by the mature bone. An example of immature bone can be seen in alveolar bone and healing of fracture. They form rapidly so that many osteocytes are incorporated. This is an image, histological image of the compact bone. The blue circles denote a single Harvesian system or osteon. The osteon is the basic metabolic unit of a mature bone. Here, this is the cancellous bone, which are formed by the plates or spicules of trabeculae. In between spaces is the marrow spaces. If the marrow space is larger, it is called as marrow cavity or medullary cavity, which contain bone marrow. Let's see the difference between woven bone and mature bone. Woven bone is also called as embryonic bone and it is immature in nature. It is formed during embryonic period or intrauterine life of a child. Whereas mature bone is matured, the embryonic bone gets replaced by mature bone during adult life or after birth. The collagen fibers of woven bone are irregular, whereas interfibrillar space is more, which comprises of proteins and water. The matrix is hematoxyphilic or blue in color. This is mainly because of increased amount of proteoglycan in the bone. Woven bone is formed faster and mineralization occurs, whereas mineral density is low and water content is high. Matrix vesicle mediated mineralization is seen in the woven bone, and osteocyte can remove the woven bone completely. Whereas mature bones, the collagen fibers are orderly placed. The interfibrillar space is less. It has an eosinophilic matrix. The formation is lower and mineral density is high. The water content is low. The collagen mediated mineralization occurs here. Osteoclasts can only remove the small portion of bone at a time. This image shows the woven bone, the histological section of the woven bone, whereas here you can see mature bone. As you can see, the woven bone is irregular. There is large number of osteocytes seen here, whereas mature bone is much more orderly or organized. You can see osteomes. Composition of bone, like I said, bone comprises of cells and intercellular substances. Cells of the bones are osteoblasts, which helps in the bone formation, osteocyte, which helps which are entrapped within the bone, and it determines the vitality of the bone. Osteoclast, which helps in bone resorption. Intercellular substances comprises of inorganic substances and organic matrix. Inorganic substances comprise of hydroxyapatite crystals. They are in the form of thin plates or leaf-like structures which are packed in the long axis nearly parallel to collagen fibrils. This is the mineral component of the bone which provides the strength to the bone. It comprises of calcium phosphate, hydroxyl and carbonate, citrates and ions of various elements. Whereas organic matrix of the bone is osteoid. Osteoid is the unmineralized part of the bone. It contains collagen and non-collagenous proteins. The collagen component of the mature bone is 95% is type 1 collagen and 0.5 less than 5% is type 5 collagen. In case of alveolar bone, type 1, type 5, type 3 and type 12 collagen. Sharp piece fibers mainly comprises of type 3, type 3 and type 1. Areas of mechanical strain comprises of type 12. For periodontal ligament formation, it is type 3 and type 12. Woven bones, the fibers are interwoven or irregularly spaced with more interfibrillar space with crystals and acidic proteins. Whereas mature bone, the fibers are organized sheets perpendicular to each other with little space. The non-collagenous proteins of bone comprises of osteocalcin, osteopontin, bone silo protein, osteonectin, biglycan, decorin, lysyl oxidase, TRAPT, proteases and inhibitors, and various growth factors. Next, we are coming to the histology of bone. The main components are osteoid, compact bone, periosteum and endosteum, lamellase, reversal and resting lines, and spongy bone. Osteoid, like I said, it is the organic matrix of the bone. It's an unmineralized bone matrix on the surface where active bone formation takes place. So it's a partially deposited bone, and always mineralization will lag behind the bone matrix deposition. So it is around, you can always see an osteoid closer to the area of bone formation, which later get mineralized to form a mature bone. It is around 5 to 10 μm thick before commencement of mineralization, and it is a linear front. It comprises of type 1 collagen, and it stains homogeneously light pink in H&E section. So this part is the osteoid. The other part shows mineralized bone, which is much more darker shade, and osteoid is an unmineralized bone matrix which will get mineralized later. And periphery of the osteoid, you can see osteoblast. This is the osteoid. It is a mineralized. Here we have the mineralized bone. Periphery of osteoid, you can see functional osteoblast, which is depositing, which helps in the bone formation. Next is the compact bone. It has a dense outer sheath The outer aspect is surrounded by a dense fibrocollagen layer. It is called as periosteum. Periosteum has two layers, an outer layer, which is dense, irregular connective tissue fibrous layer. As you can see here, this is the surface of the bone, and this is the periosteum. It has two layers. The outer layer, which is dense, irregular connective tissue, fibrous, which is known as fibrous layer, and inner layer of the periosteum, which is osteogenic layer, which lies next to the bone. It comprises of bone cells, precursors, rich vasculature. So they help in the bone formation, they help in bone remodeling, they help in the repair of the bone, they supply nutrition to the bone. The inner surface of the compact and outer surface of the cancellous bone is covered by a thin cellular layer called endosteum. The endosteum comprises of quiescent osteoblast and osteoprogenitor cells. They act as a reservoir for new bone formation. This is an image which shows the two layers of the periosteum, outer fibrous layer, inner osteogenic layer. This is the periosteum. The inner part of the bone is lined by endosteum. It's visible here. These are the histological sections. Next is the lamellae. Lamellae is an important component of cortical bone. It comprises of, there are three types of lamellae: circumferential lamellae, concentric lamellae, and interstitial lamellae. Circumferential lamellae is seen near the periphery of the bone. Near the periosteum and endosteum, the lamellae are arranged in a parallel layer surrounding the bone surfaces. Whereas concentric lamellae, these are the lamellae surrounding the central vascular canal, formation canal. They are concentric levels, or they are formed in circles. So the Haversian canal and concentric lamellae together forms the osteum. An osteum contains around 20 concentric lamellae. Osteum is the basic metabolic unit of the bone. This image, the blue lines represent circumferential lamellae, which is marked in blue. The central line surrounding the Haversian canal, central black lines, concentric lamellae, and red color marks the interstitial lamellae. This is the structure of a compact bone. The outer surface of compact bone, we have periosteum, and the inner surface lined by endosteum. The third type of lamellae is interstitial lamellae. It contains adult bones. It's present in the adult bones. These are the lamellae seen between the osteons. They represent remnants of osteon left behind during bone remodeling. Connecting Haversian canals, which are interconnected by channels that contain blood supply. It is called as Walkman's canal. Moving on to osteocytes. Osteocytes are present in the lacunae, which lines the Haversian canal. They help to provide passageway through the heart matrix. Osteocyte lies within the small cavity called lacunae, and they comprises of cell processes which lies in slit-like spaces called as canaliculae. This connecting system permits, osteocytes are interconnected to each other, and they are also connected to the nutrient supply canal. This connecting system thereby permits nutrients and waste to be relayed from one osteocyte to other. You can see this is the cell body of the osteocyte. This is the cell process. The cell body of the osteocyte lies within a cavity called lacunae, whereas cell process lies in a slit-like spaces called as canaliculae. Osteocytes are present within the concentric lamellae, and they are interconnected with the help of osteocytic cell process. Presence of a live osteocyte determines the vitality of bone. There are two types of lines you can see in a bone, in a mature bone. First one is cemental lines, reversal lines. Second one is resting lines. Cemental lines or reversal lines are a strongly basophilic line that marks the completion of bone resorption prior to osteoid formation. They are basophilic mainly because of high content of glycoproteins and proteoglycan. They are irregular as formed by the scalloped outline of house-shaped lacunae. So cemental lines or reversal lines represent bone resorption. Bone resorption is done by osteoclast. So osteoclast undergo perform bone resorption. The line of bone resorption, completion of bone resorption is marked by a line which is scalloped. The convexity of the scallop is for the older bone, whereas the concavity faces the new bone formation. You can see a dead damaged bone. Here, the osteoclast will resorb the bone. The way which osteoclast is present is called as Howship's lacunae. Once the resorption is complete, reversal line is formed in the place which marks the presence of osteoclast, and this is a scalloped line. The convexity of the scalloped line faces the old bone, whereas concavity, where newborn deposition occurs, represents the newborn formation. These irregular lines in a histological section is called as reversal line or cemental line, which represent bone resorption. Next is the resting line. Resting line denotes a period of rest during the formation of bone. They are regular in appearance. The bony lamellae are separated by incremental lines which are formed during the period of relatively slow position. So you can see much more regular lines which is eosinophilic in color, which represent rhythmic bone deposition, and it is called as resting lines. Next one is spongy bone. Spongy bones have same cells and intercellular matrix but differ in arrangement. They appear to be like poorly organized tissue. The bony substance consists of large, slender spicules called trabeculae. Orientation of trabeculae is along the line of stresses to withstand the force applied to the bone. The marrow spaces are large. If the marrow spaces are large, it forms the medullary cavity, whereas small areas is called as marrow spaces. Trabeculae surround marrow spaces derive nutrition through diffusion. The trabeculae are lined by endosteum. The central marrow cavity is filled with red or yellow bone marrow. Red marrow is usually seen in young bones and yellow in older bones. The red marrow contain precursors for the fibroblast and mesenchymal cells and blood cells, whereas yellow marrow loses potential and filled with fat. It shows yellow bone marrow in the center of the medullary cavity, whereas in the periphery you can appreciate red marrow. Red bone marrow comprises of precursor cells and blood cells, whereas yellow bone marrow you can see the histological section comprises of fat cells. So again, I'm winding up. Bone is a hard tissue, comprises of mesoderm, which is made up of mesodermal organ. It comprises of cells, intercellular substance, and organic matrix. And in organic matrix and inorganic matrix, formation of bone is called as osteogenesis or ossification. The bones, there are two types, immature bone and mature bone. There are different types of bone based on shape and microscopic based on shape. Thank you.